You're watching Parker Success Academy with Dr. William E. Morgan.
Hello, I'm Dr. William E. Morgan, and this is Parker Success Academy, where we explore models of business success in chiropractic practices. Today, I have a very special guest, Dr. Evan Katz. Dr. Katz, welcome to Parker Success Academy.
Thank you so much for having me, and thank you for all the work that you do for our profession and everything else. I appreciate it.
So tell me a little bit about yourself and your practice.
Yeah, so I'm originally from New York. I practice in Boulder, Colorado with my wife, Dr. Seana, and we have a 17-year-old daughter that is taking up all of our time as well as our practice.
So what's a fun fact about you that other people may not know?
Let's see, fun fact. After about 11 years of training, I got my black belt in Brazilian Jiu-Jitsu, and I'm a huge fly fisherman as well.
Oh, great combination.
You may know that. So
I've spent a few years rolling around on mats myself, and I just learned how to fly fish this last year. What an awesome sport.
It's as crazy as it sounds. They're both very technical. They're both very patient, and they could be incredibly rewarding and frustrating at the same time.
Well, I think jiu-jitsu and chiropractic go together too. When I go to a jiu-jitsu seminar, it's when you're learning techniques, a lot of times it's very similar than if you go to a technique seminar with chiropractors.
Oh yeah, I mean, and you realize that this much can be the difference between succeeding and not.
Or a broken elbow.
Exactly, like from winning or getting beat. Like it's
right.
Those technical variances.
Yeah, the nuances of a.
It's amazing.
Yeah, so you're exactly right. So moving from jiu-jitsu, can you explain your business model and how we became connected?
Yeah, so we like to think our business model first and foremost is to give really high quality care, high quality chiropractic care that we want to educate our patients into what is wrong, and with that. Over the years, we have implemented in digital motion x-ray, which we've had for about 18 years now. And we implement in on a lot of these patients, digital motion x-ray to really identify the true structural aspect of their spine and then see if we can correlate that to why they're having problems and then what can be done from our perspective to help these abnormal problems. So our practice is, first and foremost, as we say, great quality patient care, patient-centered treatment with a lot of evidence and research to validate why we're doing what we're doing and why they may be suffering, and then explaining and educating them as much as we possibly can.
Well, that's I forgot how I came across your website, but seeing these motion X-rays, they're astounding. And showing somebody with an orthopedic injury or post-surgery or post whiplash. They're astounding, and you've got some fantastic images on your website.
Yeah, and we're in the middle of changing our website, but it's definitely changed our practice in terms of the things that we have seen that can routinely go miss or underdiagnosed, and without knowing, you can't potentially give the best care, and you also can't educate that patient as to why they are or may not be getting well or as well as we want them to as quickly. So it's having that additional information to say, this is a problem. We don't see this often in asymptomatic individuals. And with that, we can then educate them, give them appropriate treatment that we think is helping and see if it's helping. And sometimes we may have to co-manage with other providers as well, based on other things that they may have to offer some of these true biomechanical problems.
So you're looking at motion and function using this tool. Now, for myself, I spent most of my career in hospital-based chiropractic. We didn't have motion, video fluoroscopy, but we had MRIs. So historically, chiropractors have been limited to using X-rays, looking for that lesion that we treat, and basically. We're finding that a lot of these motions are either soft tissue motions, like we talked earlier about lumbar disc herniation you can see in the MRI, or a aberrant motion that you would find on video fluoroscopy. So what have you learned? You've changed your view of chiropractic since you've been involved with video fluoroscopy type type evaluations?
Well, one, I think how it's changed is truly how effective really good chiropractic care can be. We've published some cool papers. We published one in the Journal of Brain Circulation where we saw abnormal curves, and we linked that to, we did multiple MRI angiograms to look at blood flow into the brain. But we also see that with these significant biomechanical abnormalities, that certain treatments can really help them. And we have another paper that should be published soon where we took a specific pathology that there hasn't been anything outside of surgery, and maybe one other technique that has been published to help, that we actually now have shown on multiple patients, we can improve this pathology. So it's changed our practice with, one, realizing that the days of saying that a person has a whiplash injury or a soft tissue injury are gone. It's too complex, right? A soft tissue injury can be an alar ligament. It can be anterior longitudinal ligament. It can be a facet capsule. It can be a vessel. All those things are soft tissue. It could be a testicle injury, right? They're all soft tissue with different outcomes. So when we look at the spine and we say this patient has a soft tissue, we now have to say, well, what soft tissue is it? Because maybe the posterior column can heal differently than the alar ligament or the apical ligament.
It's funny.
All those things are going to give different of how we can instruct this patient and then what our treatment can actually fix.
I remember a medical doctor telling me, well, that's just a soft tissue injury. And my response was, well, tell that to Christopher Reeve.
Right, absolutely. Absolutely. And I always joke, I've testified a lot in court where they say that. And I'm like, okay, well, what about a nail through your testicle? Do you want me to tell you that that's just a soft tissue injury? You're not going to tell that $30 million contract football player that tears their ACL, get up, it's only a soft tissue injury. But for some reason, when it comes to the spine, we look at it as it should be better in a couple of visits or a couple of weeks. And the research clearly does not support that in the slightest. Now, what it can support is if you say it might just be a sprain or a strain, but if you have true instability, true failure, true structural and functional changes, there's zero research to show that it will just get better. And in fact, most of the research shows that if left untreated, it will get worse and lead to significant chronic problems and increased disability.
Well, it sounds like you have a practice based upon patient-centered care, but also evidence-based care. And not only that, you've contributed significantly to the body of evidence. So you've had a few research articles come out. What kind of research articles have you published, and where have you published?
Yeah, so we published back in 2007. We did a paper, I think it was like 261 patients, where we looked at crash vectors, and we got that published in the Journal of Pain Physician with other great providers, looking at do car crash impact vectors change stability patterns of the cervical spine, and is it a difference between men and women? I published in the Journal of Brain Circulation, where we were the first ones to show that true structural, like a loss of the cervical curve, can decrease blood flow in the brain up to 225%. We published an article in Spine Journal, and then we just published another, me and Dr. Curtis Fedorchuk and Douglas Lightstone and multiple centers. We took patients with spondies and we imaged them, treated them, and improved the structure and minimized the spondee. And that's the first paper ever to show that the type of chiropractic care that we gave can truly reduce spondies, which it's never been able to be shown.
Jesus.
And we published that in the Journal of Musculoskeletal Radiology. I believe that was just recently. And then we recently just published the largest biomechanical paper. It was Dr. Freeman, Dr. Scott Rosa, a bunch of other providers, because it was about a 7-8 year project. We took about 200 patients. Some had pain of 6 weeks or more after a trauma, and others never had neck pain that lasted more than a week in their life. And we blindly read their images on DMX on this motion study, and we measured 37 parameters. And we looked at upper cervical instability, flexion, extension, translation, angulation, even facet stability, facet gapping, facet encroachment. And we looked at mid-phase range of motion, like spinous process rotation and spinous process fanning and engagement in the mid-phase. And then we compared that to the asymptomatic population. And we now, for the first time ever, we truly can describe what percentage of a likelihood that patient is to have a problem compared to the non-symptomatic population. And we just got that published in, I think it was the International Journal of Environmental Science and Public Health. It was a high impact journal.
Wow. So would it be possible to even see some of your imagery on the screen? Could you share that with us even now?
Yeah, I'll show you a couple of crazy videos that we saw. Some were really bad, and we'll just show a lot of different, because seeing it can really make a difference. Let me see if I'll share my screen here. This is the blood flow paper that we did, and we got this published in the Journal of Brain Circulation. And what we did was we looked at abnormal curves. This person had abnormal cervical curve. This is the circle of Willis. And then we used the PhD from CU to measure pixel intensity, so it was objective. And then without the patient getting off the MRI, and we funded all this ourselves, we did this on multiple patients, without them getting off the table, we put their neck into a normal lordosis. And this is what we found. And we did this on multiple patients, and there was a linear regression that the worse the cervical curve, the less blood flow. And the more we got a cervical curve into their neck, the better the blood flow. And then the DMX paper, I'll just show you this here, Environmental Journal of Environmental Research and Public Health. And this is what's fascinating here, is we looked at all sorts of parameters. And then we can show here, this is the asymptomatic, here's the symptomatic group, 119 people, asymptomatic, female, male. And then we looked at C1 overhang, C2 translation. You can see the difference, the varying difference in, let's say, facet gapping. Look, at 4-5, we saw 34% at 4-5 had facet gapping in the symptomatic injured population, and only 3.9%. Here at 5-6, 37%, and we found none in the asymptomatic. And this was written, looked at blindly. These are all the parameters we looked at. And then here's the cut point analysis that we did to show the percentage of likelihood that somebody is injured with certain findings on DMX, so we can truly show if the person is injured. And then I will show you just some of these, kind of what some of this looks like, which is pretty here.
Damn.
The patient was involved in a car crash, diagnosed with whiplash, had flexion extension x-rays, and it was
that
missed.
one I sent right to the ER. But what's fascinating about
Unfortunately
this,
for him, he had to have surgery, but luckily for him, he didn't die.
that person walked in after a crash. They had headaches. They had no neurological findings, right?
Wow.
So we see stuff like this all the time, where it's like, oh, neck pain, no problem. What do we do, right? So we're looking at, here's a fascinating one too that just came in the other day. So watch C7. When she extends, this should extend, but it flexes first, showing that there's damage to either the interspinous ligament or something else. Watch. It extends and then it goes into flexion. That's completely abnormal spinous process coupling that you don't see in the asymptomatic individual. We look at parameters like this that are going to tell us, like, okay, what can we do with this? How can we change this? How can we help this person? And people say what we do is quackery. I mean, this patient had neck pain and they kept fusing. And we can see now they're getting tons of movement at their skull base because nothing else moves. And that just loads the accessory and alar ligaments a ton. And that's something, can we help them? To some degree, but knowing is the first step as opposed to potentially guessing.
Wow. So this is exciting. And I think it's not only the care, but also I would imagine that you attract a lot of PI cases with this.
Well, we do see a lot of PI, but it's funny. We do, because the whole med legal thing is frustrating on one hand, but on the other side, I like it because I like testifying, because I want to answer these questions, like ask. Like the stuff that insurance companies usually say has zero evidence. Like it doesn't make sense. So it's like, great, you bring what you have. You say the patient should have got better. And we're going to explain why this patient still has problems and why they need ongoing care. And in terms of chiropractic, we just did, I just testified in court on, and I defended 206 chiropractic visits, and the jury awarded $1.1 million. And the reason is that sounds crazy. It's nothing else was going to help this woman. And because of the evidence, the way that I document and how she responded in my office, we were able to explain that chiropractic kept this woman's quality of life at a state where she can function and work and be productive in society. And without it, she got worse because we can explain and show the pathologies that she had. I documented what they meant and what the research shows they mean long term. And if 206 visits seems like a lot, I mean, look, when people have high blood pressure, they take pills for the rest of their life. We're trying to manage these patients because we can explain what the consequences are of the pathologies that we found. And that whole basis of, they should have gotten better in 12 weeks, not if it's a alar injury or instability or kyphosis. Those things show that they will get worse without appropriate treatment. And then we can show how our treatment helped these patients. And chiropractic, I think for most of these people, they're truly biomechanical issues, right? Whether you want to call it a subluxation or whatever word you want, in our paper, what else is going to address an abnormally functioning spine better than really good chiropractic care? I don't know what it is. I haven't seen it.
No, and like as I said, going to your website and seeing it was alluring to me. It was attracted to me. I could see if I was, if I'd been injured, it's like, well, this guy really understands how the body works, and you can see the lesion on your MR or your motion X-rays.
Amen.
So, in addition to chiropractic, do you have any other professions in your office?
No. We don't. We do chiropractic. We do a lot of like some CBP work to really fix the curve. Our goal, our treatment is if they need something else, we refer them to that particular office. I know there's a lot of practices out there that have it mixed, and that's great. It's just not it. I like simple, and I don't want that. It's just so much to manage. And, I have friends that do, and I'm like, oh man. And we also luckily we have really good providers around us that understand what we do and are really good at understanding these injuries that we can co-manage with, and we try to get to their office. So, we've never lost a patient to any of them because they understand how our co-management is incredibly beneficial, but we give patients options, and that's what we want. That's what we want all MDs to do, right? Is I want them to look at these patients and be like, there's a mechanical solution to this. Go see Dr. Katz. In the same way that we're like, hey, here's what you have, but you might need a little bit more. We're going to co-manage. And some of those are, we used the inventor of orthobiologics is near us is Dr. Centeno, and they can do very fantastic treatments. We have some neurosurgeons in the area that really understand this, that are very conservative, where they're going to be like, look, this is a real problem, but if what you're doing is helping, once we fuse, there's no divorcing that.
Yeah.
So do what you can to keep them out of our office.
So you started off with chiropractic biophysics. Is that your background?
When I was in school, that clicked with me because I was like, oh, this person has this abnormal alignment. Can this alignment be fixed? And then I did go through DMPEGs, CBP, and have worked with them because I like the research that they've done, and it made sense to me. It clicks where it's like, here's normal, here's abnormal. And the same thing with our paper. You can't say something is too much unless there's already, or too little unless there's been an established normal. And they've done a really good job, I think, of showing, hey, here's the research on normal alignment, here's abnormal, and then what does the evidence suggest can happen?
I actually met my wife in Don Harrison's office. So I started off with chiropractic biophysics as well. But it's odd to see some emotion, because I would say you're kind of a motion guy compared to a static listing, guy.
Well, I think we progress, right? And that's what's fascinating about it, is they've also embraced that, is looking at the motion, the structure and the motion, and the structure dictate function, and looking at that, like if there's instability and there's, let's say, abnormal structure, does one make the other worse? And how can you address that as a whole to improve all of it?
That's awesome. So, as I move on with this interview, what's your personal definition of success?
I think going to bed happy, and fulfilled. Personally, I think I'm fortunate that I have my wife and my kid and my family. And I love what I do. I like going in and learning new things. And I think that's success. I think also being able to have a career where I improve people's quality of life And it gives me a great quality of life as well, is a huge definition of success. You know, we work 4 days a week. Wednesdays, I go hike and fish. And that, man, I feel like that's what success is. And I think especially in this day and age, being and staying healthy is you're winning, you know?
It truly, we're filming this during the COVID crisis, where people who are not healthy are dying. People who are obese and have an inflammatory lifestyle. Is there a book that you would recommend?
Oh, a book that I like?
Yeah.
Oh, let's see. That's a good question. I'm reading one book now called Faster, but that's just interesting history book. I think, gosh, one that I think kind of left a little bit of an impression on me. A lot of books have, but how would I say, like The Art of Racing in the Rain. That was a cool book to me. That it was like a guy who loved doing what he did, which was racing, and he did everything he could to get into it, and he was throwing a lot of crazy curveballs that could have completely pushed him off line. And I think that happens a lot with us as chiropractors, right? Where we love what we do, but we hear all this outside chatter from even our own profession and outside of profession. Oh, chiropractors are quacks and this and that, but it keeps me focused to show, like, look at what we can do. And if you don't have love for this game, you're not going to be a chiropractor for long. And I felt like that book he loved it. And whatever came his way that kept knocking him off course, you shouldn't be a dracer, you shouldn't do this, it kept pushing him back. And not only did it make him better, but he also realized that this is what made him. This is what grounded him. And I felt like we're reading that book, I'm like, yeah, this is kind of what we do every day. Like, you keep getting pulled in different directions, but for whatever reason, you keep coming back to that, and it keeps me and my wife grounded of, like, this is who we are, and no one can ever take that away. So that.
Well, as a chiropractor, you're giving people back their life. As a chiropractor, you're giving back their life. They're giving people back their lifestyle, and to see. It's not all in my head. I'm sure you have that. When you showed video fluoroscopy and people see, that's why you've got this problem. They're grateful. Right. Even though you're showing something's wrong that maybe you might be able to fix, they just want people to know they're not crazy.
Well, you bring up a great point, and that's one thing that technology has done in our office. The amount of people that have cried after showing them, and it's not because they were glad that they had an injury, but they said exactly what you said. So it's not in my head, because they go to these providers, they do real simple, it's the same stuff. Oh, we did this, it shows nothing. So because I can't figure it out, it means you're crazy. As opposed to, maybe we just didn't uncover it. Maybe we just don't know enough. And if you think you know everything, you're going to be really disappointed. We learn something new every day, or we should. And these patients just cry, and they're like, and then what that is like, okay, let's forget what happened the last 10 years of you suffering. Let's look at this as day one. We have new information. Now let's talk about what we know and why we believe this is related, and how do we get your life back? And then it's not just the validation, it's you can now start to treat and educate based on what you found. And then those patients went from suffering for years to starting to get their lives back, because now they know what position is worse. They know what can happen. They have an understanding of what's wrong, and then why our treatment is effective and how we can help them. And that's when you see the greatest changes. And to go back a little bit, we said, oh, you do a lot of PI. We do, but what we see mostly, and it's sad, is we see the patients that were in crashes years ago, decades ago, and they've gone to the providers that kind of got them in and got them out, and went with the lawyers that just burned them and churned them, and they've been in chronic pain ever since. And then they come to our office, case is closed, they barely got enough to cover their bills, and now they're paying out of pocket, and we analyze them and show them, and they're like, how come no one else has ever told me this? And it's like, I don't know. So you get a lot of, we get a lot of PI patients that their cases are closed because no one took the time to identify. It was just trying to get these real quick, try to make a buck. And I think if you love what you do, similar to what you were saying, the fulfillment of getting people better and educating them, you're going to be so fulfilled, and the money will follow. The money, if you do a great job, the money will follow.
Yeah. I often say value or money follows value. Is my job not to be successful? My job is to create value as a chiropractor.
Absolutely.
If you create value, success and money will follow. But
right. And I always say, you see all this stuff, sales stuff in this, is I never sell my care. I never sell chiropractic. I'm just going to educate you on what's wrong and educate you on how I can help you. That's it. There's no sales. Like, this is what I do. Here's what's wrong. Here's the information. I give them the information about what's wrong, what these injuries mean, why it's a problem. And I educate them on what my wife and I can do to help you. And if we can't help you, we're going to try to find someone that can based on what we found. I'm not selling you anything. Oh, I'm not buying it. Good. I'm not selling it. I'm just here to educate you. This is what I found. This is what I know. This is what the evidence shows.
Yeah, we're healers, not salesperson. Now, is your wife in your practice also?
Say that again?
Is your wife in your practice also?
Oh, yeah. Yeah. It's her and I.
Is she also a chiropractor?
Oh, yeah. Yep.
Where did you guys go to school?
We went to school at Life West.
Nice. I went to Palmer West, and that's Dawn Harrison practiced down in Sunnyvale. Is how I actually met her there in school. So, in your practice, what's the worst moment in your journey?
The worst moment. I hate to sound this because it might sound cliche, but the things that bother me that I feel the worst are patients you can't help. There's bad things that happen, and you can look at like, oh, I hate arguing with this or, dealing with that. But I think the worst feeling is when, you just can't make any headway on a patient. That to me is what keeps me up. That's the worst. I don't know if that's the answer you were looking for, if there's a more specific, but man, that's the worst. That's the worst thing. I guess you could say, luckily, knock on wood, I've never hurt a patient or had something like that happen, which would be horrible. But I think it's also, you're doing everything and you're trying to do your best and you can't. And there are those patients, if any chiropractor says they get everyone better all the time, I want to meet them because, there's some that you're like, wow. And I think that's the thing that keeps us driven is, well, what is wrong? What's happening? And we don't know everything. Like, what I knew when I graduated is way different than what I know now. And what we're talking about today, if we meet in 20 years, we're going to know different things. So I think that's the worst.
I would agree. And I've worked in Walter Reed during the dark period of the war where we had people blown up, lost limbs. And there was days I would just shut my door and weep. There's certain, you can't help. There's the people that some people, all I could offer them was a prayer.
Or even like a hug.
Yeah.
And I have a patient that she's just been suffering and she's been getting a little bit better. And I literally said to her that I'm like, do you need a hug? Because it's like, there's those patients it's like, if I had a magic wand with only 3 waves, I swear I would use one on you, because you just see like how much some of these issues completely disrupt their quality of life. It's a chronic pain or spinal injuries or, pain is so draining. And it's like, and I've been there, I've been that patient where you can't get up off the floor and your quality of life is gone, but we can restore that with chiropractic, which is amazing.
It is amazing. And we take it for granted how awesome it is. So, as we move forward, is there anything you'd like to leave our audience with and possibly even some contact information that people can contact you with further questions?
Yeah, sure. I think, let's see, you can always contact me. One, my email is Katz, CHIRO, Katz@hotmail.com. And then I also have a website where I have all this information on it, which is professionallyintegrated.com. I don't know if I'm allowed to plug it, but if you want, that's where all my information is and information.
Professionallyintegrated.com.
What's that?
It's professionallyintegrated.com.
Yeah. Nice. And I have research and webinars on there, like everything that I use. It's how I built my practice.
Wow. So would you recommend people to use this technology to not only provide better care, but to build their practice?
Well, a lot of it's not all DMX based. It's all about, facet injuries and instability and how does it affect the patient and research that's on it, that, clinical aspects of how do we identify it in practice? How can we treat it? I have webinars on there with some of the top neurosurgeons, inventor of orthobiologics, other providers that work with us, that we go, that there's just tons of information about it. You see a patient with a disc injury, what does it mean? Well, here's research on discs, here's research on facets, on loss of curve, all that wonderful stuff. And what would I say to a new grad?
Yeah.
Is that what you're asking?
Or so what information would you like to leave us as we finish our talk today?
I think for all of us to truly understand how powerful chiropractic is and how we can affect patients' lives. What we see on a regular basis with horrible stuff doesn't really have a lot of options, and certainly not better options than great chiropractic care, right? A lot of what we're seeing in the evidence and the research, that patients' pain and decreased quality of life as it relates to the spine has to do with structural and biomechanical abnormalities. What do you know that is the best at improving structure and biomechanical abnormalities other than chiropractic? I haven't seen it, right? So when we look at that, we really see wow, we're not just cracking their neck. We're not just trying to increase range of motion. We're trying to minimize abnormal stresses on the spine that can affect the vasculature and central nervous system, not just today, but long-term. And that is huge, right? We're looking at all these long-term outcomes of degeneration and hospitalizations. And we need to take a step back and say, well, what would happen if we got to those patients and we can improve those findings that are shown to break down over time? How much money can chiropractic save the world in healthcare costs and days off and disability costs if we can actually start to educate our communities about how we can help them both in the short and long term, and never lose sight of that, of how incredible what we do actually is. And look at our profession, look at your school. Our profession has been under attack consistently by certain groups, but we keep on stomping forward with huge success rates from our patients. Why is that? It's because what we do freaking makes a difference. And now we're starting to see how and why, and being able to objectively show that. And that's if that doesn't excite you as a chiropractor, call me and let me explain and show you some other things, because I've seen some crazy stuff and we can show amazing things that we've done. We all can.
Truly. Well, thank you for being with us today. You've been listening to Evan Katz, and this is Parker Success Academy.
Thank you so much for having me.
Thanks for watching another episode of Parker Success Academy with Dr. William E. Morgan.